Brian Abelson from Kinetic Health. Today I'm going to go over iliotibial band syndrome and how to resolve it. This is a really interesting condition because certainly my perspective has changed over time as we've got new research on it. So first, before we get into anything, let's just go over some conventional perspectives, a little bit of anatomy here. First thing I'll do is I'll just kind of show you where the IT band is here and what it's made up of. So I'm just going to tape a few areas right now. Okay, so what I want to show you here is that the IT band, from a conventional perspective, is formed on the side of the leg. Basically, comes together. You've got fibers from the glute max, your glutes, external hip rotators, glute medius, and the muscle in the front called the tensor fasciae lata. Comes together, runs down the side of the leg, basically drops down below and connects into a place on the below the knee here called Gerdy's tubercle, which is on the tibia, femur here. From a conventional perspective, they say that this band actually goes back and forth like this, anterior, posterior. And you create friction on one side here. And as that happens, for example, a person's running over a long period of time, there'll be thousands of repetitions. And this will create micro tears in the tissue, you'll get some inflammation. Next thing you know, you've got severe lateral knee pain. Now, this is exactly what I used to actually teach, and this is what I thought for a long time was the case. And then with MRI studies and more information coming out, we've learned a lot. Certainly the IT band is right along the lateral side. And it is formed in the upper part from the glutes, tensor fasciae lata, small muscle there, gluteus medius. But one of the main characteristics here is that it's actually just a thickening of another substance, an area called the fasciae lata, which is connective tissue that surrounds the entire leg like a glove or a sleeve. And the iliotibial band is just a thickening of that fasciae lata. Now, if we look at the IT band, it's not sitting on top of the surface, sliding back and forth. Underneath that, we've got deep, deep fibers that connect all the way in to the leg bone, the femur. Now, those fibers are part of what we call an intramuscular septum. Now, it's really interesting because if we look at that, we start to get more of a three-dimensional picture. We get this band on the top, but we also get something that's almost triangular in shape that goes right down to the femur. Now, these are very strong connections. And as we get close to the knee here, there's a part on the edge of the femur here called the lateral epicondyle. Fibers from the IT band go right into the bone. The outside of the bone is the periosteum. This goes really deep to that, and it basically holds it in place. So this anterior-posterior motion is almost impossible, which is really interesting because you have to say, okay, if it's not moving anterior-posterior, what's going on here? Also near the knee here, they used to say when the inflammation comes up, it actually creates some inflammation around a bursa. A bursa is a fluid-filled sac that basically decreases the amount of inflammation between two different surfaces. Well, when they've done MRI studies, they go, well, where's the bursa? They're having a really hard time finding it. And they found that actually what there is below the knee here is a fat pad, a highly innervated fat pad. A fat pad with lots of neurological receptors in it. So the problem is more of a compression syndrome than anything. Now, you say, okay, what can cause this compression? Well, several things. Weak glutes up here. When the glutes get weak up here, the tip of the pelvis tends to tip from one side to the other, like this. And as that drops down, that creates stress along the entire IT band here and causes compression at this point. So we've really changed our perspective in terms of, what's causing this, what's going on, and how we have to treat it.
Hello, Dr. Evangelos Milanas. Now we'll be discussing the function of the iliotibial band. So when we look here at the tape that Brian placed earlier, you can see that the iliotibial band connects right into the muscles on the side of the pelvis here, the gluteal muscles. And these are very important muscles because they're involved in pelvic stabilization. So looking at the band as it comes down, when you're walking or running, at a certain point during that gait, called the stance phase of gait, when you're on one leg. So we'll have Mickey go on one leg here. Yeah. So in this position here, that iliotibial band basically helps to stabilize the leg, at the hip and at the knee here. Okay? So if there's any weakness in the gluteal musculature here, that's going to affect that iliotibial band directly and its function directly. So to demonstrate, we'll have Mickey turn. So you're back towards Cat. Perfect. So I'm just going to come over to this side. And there's a simple test we can do here to test the musculature. We'll have Mickey stand on one leg. Now, if the muscles were weak, we'd get hip drop. So the hip would drop down this way. And as you can see with my hands, as the hip drops here, I can literally feel the band tightening up on this side here. Can you feel that?
Yeah, I can feel it pulling in my knee.
Yeah. So it's literally pulling from here all the way up. And what that does, one of the hypotheses is that it pulls and compresses at this site here. And below that, behind it, is a little fat pad, as Brian mentioned, that's densely innervated. And if you create a compressive force there due to weakness here, that's going to create pain, which develops into the iliotibial band syndrome. Now, if we come back up this way, you can see right away my hand slides down slightly and there's way less tension here on the side. Can you feel that?
Yeah, it's more comfortable.
So, pulling up this way, you can see increase in tension, increase in compressive force at the knee, and coming up this way, just a better all function, less compression here at the knee. Okay, thanks. So I'm come back to this side here. Now this brings up a good question. When we look at the actual structure of the iliotibial band, it's dense, fibrous tissue. And the question that arises is, can we actually stretch that tissue? And so, it brings into play all these thoughts of, should we be rolling it? Should we be stretching it? What are the effects there on that tissue? And we'll be getting into that in the next segment.
So Evangelos posed a very good question. Should we really be stretching the IT band? Can we actually make a change there? When they do research and they put weight on the IT band, they really can't deform it at all. It's not very plastic. You get on there with a foam roller, it's an incredibly painful area for most people to work on. Does this mean we shouldn't stretch and we shouldn't use the foam roller? If you do a Google search, you'll find a lot of people discussing this and a lot of people saying, no, don't stretch, don't use the foam roller. I disagree. And I disagree for several reasons. If we actually look at the anatomy of the lateral line here and not just consider these structures here, but think about what is actually below this, we'll see that the IT band, it doesn't just stop here. The fibers, the fascial connections actually go into the peroneal muscles. We start to go up here and we'll see that there are connections up into all the way up from the side into the intercostal muscles, right up into the head. So the point being that everything above and below this point may actually affect the function of this area. So when it comes to stretching, I say stretch it. When we look at people resolving conditions, we'll see that when we look at a larger kinetic chain, we'll get better results. So, we don't want to just stick with one thing. Another key point here is that if we're going to use a foam roller, yes, it may be a little bit painful going on the side here, but are you going to actually change the anatomy of the IT band? Probably not. Are you going to affect its hydration, or you're going to affect the amount of fluid exchange in that structure? Are you going to get more nutrients in it? Yes, you are. You're also going to have a neurological effect because there are a lot of receptors, neurological receptors in fascia. And that's one thing I'm not seeing people talk about that much, is the fact that there's all these sensory receptors in there. As soon as we start working on an area, we start toning down the nervous system. We actually decrease the amount of sympathetic activity, so muscles aren't as tight as in the general area. We'll get some major changes neurologically. So we need to stretch, we need to use a foam roller. We're going to go over a few exercises, and these are just examples of the multitude of exercises that we can prescribe.
As Brian mentioned, we need to stretch all the structures along the lateral line. And one of the exercises we use, an example of one, would be a lateral line stretch using a Swiss ball. So we're going to have Mickey lie across the ball here. You want to make sure the ball's stable. There we go. Yeah, perfect. So as you can see in this position, Mickey's stretching everything along that lateral line, from the ankle, foot, all along the peroneals here into the IT band, the hip, across the side of the abdominal wall here into the ribs, and literally into the neck. And as you can see, as her head's down there, she's stretching everything from the neck basically down to her foot. It's just a great exercise to stretch out that lateral line. As Brian mentioned, it's not only important to stretch the entire lateral line, but to get in there and actually use a foam roller to work out the IT band. So we're going to demonstrate with Mickey here. So lie on your side, perfect. Okay. Now there's some key points here. Brian talked about the density and how fibrous that IT band is. You're not really going to break up restrictions within it. But what research is showing is that by moving in slow increments, you can actually hydrate the tissue. you're also putting pressure on neurological receptors in the area, which have an effect on the autonomic nervous system, causing all the structures in the area to actually relax. So you're going to take off tension from the entire area and just kind of loosen up all the structures above, below, behind, and in front. So that's got some really important neurological effects. So we're going to have Mickey start to roll. And the key here is, based on the anatomy of the IT band, we know it's more of a wedge-shaped, of a triangular-shaped band that goes down and attaches onto the bone. So we don't want to just roll back and forth. We actually want to create a shearing force. And in order to do that, we actually need to go side to side slightly, almost rotating forward and back. Can you feel that?
Yeah.
Yeah. And so you want to make sure you roll the entire width of that band. It's about that wide. You want to go just past it on the front and just past it on the back so that you can affect the musculature in front and behind it. And so we're going to move this down a little bit. So you're going to work the entire length of the band. And you can see stabilize your upper body with your arms, use your leg to help create that rotational force there so you can create that shearing stress across the band. How's that feel? Good.
Good.
Move it down a bit. There we go. So it might be sensitive as you get to the middle there because it's fairly close to the bone. Yeah. Good. We're going to move it down again. And now we're getting into a key area here. The entire length of the band is important, but a lot of the problems with the ITBS, with the iliotibial band syndrome, is at the knee. So you want to make sure you really work all the fibers across the knee. And we'll move it down just a little bit further because the band actually crosses the joint and attaches onto the Gerdy's tubercle, as Brian mentioned. How's that?
Tender.
So you probably want to spend about a minute doing this. You really need to work the entire length of the band. Make sure to focus on those tender areas. Good. Great. Okay. And you know, if you are in an acute stage, if it's really inflamed, if the foam roller is too painful, you can use a ball, but make sure, you know, it's a bit of a squishy fit ball. You can see I can actually compress this. So you'd use this in place of the foam roller, and you roll it back and forth, and it'll compress somewhat, so it won't be as painful. And you want to make sure you do circular motions to create that shearing force. And that's the advantage of the ball, the direction. You can move it in a lot of different directions.
So if you have a case of IT band syndrome and you've done the stretching, the myofascial, self-myofascial release with a foam roller or a ball, and you find you're still not coming around, you may want to get some treatment on the area. Just make sure the practitioner is actually considering not just the soft tissue, but also the joints. Is there a restriction in the hip? Is there a restriction in some other area? And when they do get on the IT band itself, make sure they're actually doing therapies that create a shear force across the IT band. Okay, Mickey, I'll give you an example here. Let's say we go underneath the leg here just to support it. And one of the techniques we use is actually just to try to get on an area and just use our forearms here a little bit. Just bend your top leg there a little bit. Good. Okay, how are we doing there?
Good.
Feeling that?
Oh yeah.
Okay. It doesn't take much to actually create a shearing force on here. If you're on an area and we stay there, this is actually going to be quite effective. You okay?
Mm-hmm. Yeah, I'm good.
Good. But you work all the way down the leg here. And we would do this for several minutes. But in a lot of techniques, they perform techniques that are actually very similar to rolling up and down the band. They don't do techniques that actually create the shearing force, and that is incredibly important. So again, if you see a practitioner, make sure they're taking a lot of different areas in consideration, seeing a larger kinetic chain, looking from the bottom of the foot, doing biomechanical analysis, considering everything above and below the joint. IT band problems can be resolved, and usually within a relatively short period of time if you take the correct approach.